But welcome to our global participant base, everyone in different time zones around the world. So I know already we've got people from Singapore, we've got people from, obviously, Marina from Russia, we've got our colleagues from Dubai, Sydney, Melbourne, Canberra, so all over the place, and of course Brisbane, where we're hosting this event. And I would have really loved to be somewhere with you in one location, all in person. Maybe someday, hopefully soon, we can all get together and celebrate this again. But for the time being, we'll have to settle for a Zoom. And before we get started, I'll just acknowledge, as we're running this out of QUT, that we acknowledge the Turrbal and the Yugara as the First Nations owners of the lands where QUT stands, and we pay respects to their elders, lores, customs, and creation spirits, and we recognize that these lands have always been places of teaching, research, and learning, and we acknowledge the important role Aboriginal and Torres Strait Islander people play within our community. So today is a really great opportunity to celebrate not only the launch of our book, which was many, many years in the making, but also how we've all survived through COVID and got through what was probably one of the most challenging years that we will remember for time immemorial. Particularly for us in higher education, we've had to put all of our curriculum online in the matter of weeks. We've had to be very creative with how we run our research projects. And also we've had to get together mostly on Zoom and do a lot of our meetings remotely, probably down the street from each other. But it also brought many, many opportunities. And for once, something like this where we can catch up globally and have a great chat about all of our learning experiences, and many other silver linings, which we'll learn about today when everyone talks from their different perspectives. And so I'm very lucky to have with me today a couple of very stellar friends and colleagues that I met at different points in my life, but are all very, very good friends, and also very amazing designers and academics and healthcare professionals. So I'll introduce you to them, and then we'll start with each one giving a presentation for about 20 minutes about their experience in the country that they're living in, and their perspective on design and COVID. Then we'll have a bit of a Q&A where you guys can ask questions in the chat box, and we'll try to answer them to our best of our abilities. And then we'll do a little overview of the book and celebrate and have a general chat to end the day. So I'll just give you a little overview of who we have with us today. First of all, I didn't even introduce myself, but I'm Professor Lisa Scharoun, and I'm the head of School of the Design School at QUT. This is being hosted by our design lab, the director of which is Yvonne Miller, who's with us today too. And our design lab and our design school is a very comprehensive school which covers 7 different disciplines in design, everything from fashion to architecture. And I myself have a background in cross-cultural design and visual communication design. So I worked in the industry as a graphic designer, and I've worked at various different institutions in China, Australia, the United States. So I have a lot of broad experience globally of different design perspectives, which is how a lot of these connections came about. And also how a lot of the collaborations came about that we'll talk about later in our book. But I'll be over to our first speaker of the day, which will be Danny Hills, and I'll just give you an intro of everyone, and then we'll go to Danny. But Associate Professor Danny Hills is a registered nurse, and he's a Deputy Dean in the School of Health and a Research Stream Director in the Health Innovation and Transformation Center, the Federation University. And Danny and I met each other many, many years ago as early career researchers at the University of Canberra, where we hatched an amazing idea for a study tour, which turned into many study tours and books. The next speaker after that will be Tamsin Greulich-Smith, and Tamsin founded the Smart Health Network Leadership Center at the National University of Singapore back in 2015. And she's now heading up a new real-world learning platform known as the School of X, which has been established by the National Agency for Design, Design Singapore Council, to embed design into the national skill set. And Tamsin and I met kind of randomly. I think I cold emailed Tamsin and said, "Your profile looks amazing. I'm coming to Singapore. Let's hang out." And that was several years ago. We've been hanging out ever since and collaborating on various different things. So I'm very glad I cold emailed you, Tamsin. And you picked up that cold email and rolled with it. So the next person we have speaking, it will be Dr. Carlos Montana Hoyos, and he's the founding associate professor of the Dubai Institute of Design and Innovation, which is also known as DIDI, the very first specialized design university established in 2018 in Dubai. And it's in collaboration with MIT and Parsons in the New School. He's also the acting assistant dean and co-founder of the DIDI Agile Factory Research Lab. And Carlos and I knew each other since we were baby academics at the University of Canberra, where once again we hatched up many different ideas and study tours and traveled around the world, herding students through Japan and Singapore and looking after them. So I've been very blessed to have a colleague like Carlos who we've published many things and created so many great projects together. So very grateful for Carlos here today to talk about his new life in Dubai and all the exciting things he's been doing. And finally, one of my oldest friends here today is Marina Dzhashi, who's a cross-cultural consultant from Russia, and she's currently living in Moscow, where she consults companies, both Russian and international, on how to build effective partnerships with international partners. And she also teaches cross-cultural design management or cross-cultural management in leading business schools in Moscow. And Marina and I met each other when we were way back 20 years ago almost, when we were doing our master's in London. She was studying journalism, I was studying design, and we met on a student trip. And Marina had such amazing English skills, and she had an American accent. And I said, what state are you from? And she said, Georgia. And I said, well, you don't have a Southern accent. She said, no, Georgia and Russia. So Marina and I have stayed in touch through all the various different places we've lived and worked. And once again, I'm very grateful for Marina to be here and also to still continue to collaborate with me on the crazy ideas I bring to her. So thank you all once again for agreeing to chat about your experiences and share them with us. And what I'll do now is I'll pass it over to Associate Professor Danny Hills for his presentation. And Danny's coming to you from Melbourne, which has just experienced a very sort of draconian lockdown where they've been sort of sheltering in their homes because of COVID. And thankfully that's been lifted. They're able to travel outside of their homes and outside of Melbourne. They still can't come and visit us in Queensland just yet, but I'm holding a cold drink for Danny when they do. So fingers crossed, Danny can come and visit me in Queensland at some point soon. So take it away, Danny.
Great, thanks. So now it looks like this is sharing with you.
Yep.
That's good, great. So look, Lisa's introduced me, which is good, and has covered all the things on that first slide. But what I might say is that I'm going to start with the negative side of things, and then we can get onto the more positive things. So, but I think it puts some of those issues in perspective for us, particularly from Victoria. Now my right arrow isn't going to work. There we go. So this is a graph that's well known to Victorians. It shows the new cases of COVID that occurred from when it first emerged, which was down here in February. There are a few little bumps on this graph when travellers with COVID started arriving on aircraft and cruise ships. And unfortunately, one of my PhD students was one of those. We don't know whether she picked it up in London or got it on the plane, but she's still unwell from it. So it can be pretty nasty. Notoriously, Victoria introduced a hotel quarantine for all those arriving travellers. They constructed it over 48 hours of planning, and I've deliberately put it in inverted commas because hindsight has told us a lot about what was diabolically wrong with what went on back then. And really around that time, because the cases were increasing, we went into these stage 3 restrictions, which really restricted movement, association, and in fact, community functioning. The first big outbreak of cases started occurring in one of the quarantine hotels called Ridges. There was a family of 4, 2 security guards, and a hotel employee. And so people got a little bit freaked out about it, and people didn't really know what was going on. And then within a month, there was another couple of outbreaks. 17 people working at that Regis tested positive. Not one person was told to self-isolate, so they just went out into the community and did what they did eventually, particularly the security guards. And then at the same time, there were these infection control breaches at another hotel, and the Department of Health and Human Services stated openly they just did not know how these had occurred. Not long after, there was this terrible revelation. So the Victorian government, run by the Labor Party, 3 of their ministers and ministerial advisors and electorate officers were found to be involved in industrial scale branch stacking. So it was corrupt conduct. The government just went in this terrible level of turmoil, particularly after all of the outbreaks that are occurring in COVID. And you know, under normal circumstances, you'd probably think that the Premier would resign, the Minister for Health would resign, maybe even the government would fall, but they really dug in. In many ways, they didn't have any choices because there was nobody really to fall back on in their party. And it was at that stage the strictest restrictions on movement, association and community function was imposed on the population. The harshest imposition was for the Greater Melbourne area, so we're talking over 5 million people. And again, as I say, in hindsight, it's pretty interesting. This is one of the revelations it was in about mid-August, the epidemiologist at the Department of Health and Human Services stated that 99% of the cases in that second wave could be traced back to the outbreaks in the quarantine hotels. So all in all, a pretty nasty experience. The fact is the restrictions, even though we hated them, they worked. And right now down in November, we're able to travel pretty freely now and the restrictions are really coming off and things are starting to get back to normal. This is pretty interesting. Have a look at this graph. This is all COVID cases by age and sex. And I think you'll see one of the most prominent things there is that it was young people who got COVID. Unfortunately, it was the old people who died. So the death rates in older people is really quite high. If they get COVID, particularly if they've got other conditions, death rates are just diabolical. And this is just a little bit more data. You can see up at the top, I don't know if you can see my cursor, but you can see Victoria tops the pops in terms of cases and deaths. Almost all deaths in Australia occurred in Victoria and primarily in aged care services. So our health system in Australia, for those who don't know, health, hospitals and community services are run by the state. General practice is Commonwealth funded and entrepreneurial. So it's subsidised by the government, and aged care is run by private organisations, not-for-profit organisations, and it's largely subsidised by the federal government. So lots of split responsibilities. But look, as bad as we've felt in Australia, if we look at what's happening around the world, I think we got off pretty lucky. It's been a torrid year. It's had massive impacts, but really, in the scheme of things, we're doing really well now. So just some other things about Victoria during the pandemic. The state emergency was declared for 6 months and was renewed in October. We had really harsh restrictions on freedom of movement and association. There were severe fines for breaches. But I must say it was where it was detected because it was really community reporting that was linked to most of the fines. The policing detection was really quite low, and we just had to wander around and we didn't see many police because they were all manning the ring of steel around Melbourne to stop people crossing over into the country and things like this. It was really very, very difficult. I used to joke with people that it was like being in East Germany where neighbours and family were reporting on each other. And it did feel like that for a little while. There were rapid changes to the way people work if they had a job, and particularly for people who are studying. But there was this huge uptake of online technology, and we were lucky at Federation University, and particularly in my School of Health, because we have a blended program for our nursing students, which accounts for about 30% of our university. So it was pretty easy to move everything online, but it wasn't easy for everyone. And I must say that the arts, particularly performing arts, design, and that group of topic areas and disciplines really suffered a lot. The effective unemployment rate in Victoria rose to 14%, but we can see that that's starting to ease with easing restrictions. Healthcare facilities and services actually coped well overall, with some exceptions, but aged care was hit terribly hard, and that had all the run-on effects with residents' families not being able to visit them. Universities have been damaged quite severely and may take years to recover, and we're talking about the loss of students, particularly international students, jobs and revenue. A lot of research was slowed, if not halted, and healthcare and education students' practice-based training was severely curtailed. So just as an example, we have first, second and third year nursing students. We had to stop all clinical placements for first and second years, just focus on third years, so that we could graduate students at the end of this year. If we didn't graduate students, the health system was going to be in terrible, terrible trouble. And unfortunately, the UK is experiencing this now. They're going to have a situation where they're not going to have graduating students, so they're going to have this big pipeline of new graduate nurses that's just not going to exist. So who knows what's going to happen there. And of course, the creative industries and hospitality were hit really, really hard. But everything's returning quite quickly. It's amazing how people are bouncing back. We did an interesting piece of research during this pandemic from June, and this paper was published just recently. My colleague Aziz Rahman and at the other end of the author list, Wendy Cross is my dean. So they were looking at how they were looking at distress, fear and coping strategies during the pandemic. Most of their sample was Victorian, a majority were female. What they found were all of these interesting associations. So you mightn't be used to reading these, so I'll interpret them a little bit. People experiencing higher levels of psychological distress, they were more likely to be women. So there was a 1.7 times risk of women experiencing psychological distress. And people with pre-existing mental health conditions, they were 3.1 times more likely to experience distress. And people who had increased smoking and alcohol drinking over the last 4 weeks, well, for smoking, they were 8.5 times more likely to experience distress, and those drinking 2.3 or 4 times. So these are associations. We can't tell which one caused the other, but I guess you can have a bit of a guess at which was causing which. For people who are experiencing higher levels of fear of COVID, women were 1.5 times more likely than men to experience fear of COVID, and that kind of makes sense. That group of 20 to 59-year-olds were 2.2 times, 2.3 times more likely to have higher levels of fear of COVID, which is interesting considering the high rates of death in older people. Distress due to changed employment, 4 times more likely to fear COVID. Those who are drinking more had higher levels of fear, and those who are caring for known or suspected cases were 3.5 times more likely to have higher levels of fear of COVID. This is an important one. The last point is that healthcare service use in the last 4 weeks was associated with medium to high resilience. So that's an interesting association. More resilience, more likely to use healthcare. And we know that a lot of people with chronic conditions really suffered a lot because they weren't necessarily able to go and see their general practitioner because they just couldn't, they were prohibited from going to see their GP, even though telehealth, there was a large increase in telehealth. there's a lot of things that you can do in healthcare where you really need to be seeing the person and being able to touch them. So this is all the bad stuff. Is this a case of poor system design or cases of poor system designs? New South Wales, do we have a representative from New South Wales? Yes, we don't. Vivian's from New South Wales. So New South Wales really let the cat out of the bag with the cruise ships debacle. We had cruise ships arriving. The Ruby Princess was the big name one, and people with COVID were let through the border and they spread out all around Australia and infected everybody. So this was definitely an example of poor decision making and system implementation. New South Wales, though, and most other Australian states have quite centrally controlled health systems, but distributed public health infrastructure. So this is great for managing pandemics. Victoria has 86 independent health services, and they had this small, centralised, relatively low-level public health unit. So it was perfectly designed to not be very good in a pandemic. And we saw what happened. Victoria ended up, being top of the pops in terms of COVID. So from the outset, planning and implementation in Victoria in response to the pandemic has been found to be shambolic. This is a quote from the Independent Inquiry's interim report that was released recently in the last week or so. They found poorly developed hierarchies of responsibility and control, poorly developed lines of communication, and scandalous decision-making in developing and managing a hotel quarantine program. I mean, just as an example, when the Premier of the state was asked who was in charge of the hotel quarantine program, he said, "I don't know." The other thing I would just say to wrap up this is that on the basis of our research, again, in hindsight, there was a need to design targeted interventions for individuals and community populations at increased risk of diminished psychological health and well-being, including better access to primary healthcare services. I think, just to sum it up, we've learnt so much. The whole of our country has learned a lot, and maybe some of those learnings will be of benefit to the rest of the world too. So we've suffered a little bit, but I think we've really dodged the bullet in Australia. So yes, some good things have definitely happened, and this is an example. I think our book's been published, we're launching it, and we're talking with each other, and hopefully this will be an enjoyable experience. How much time left do I have, Lisa? About 5 minutes?
Maybe less than that.
Oh, maybe less than that. Okay, so
you can do a pitch.
It's okay. I'm kind of near the end. We've been able to do all this research, and we're involved in the Melbourne Ageing Research Collaboration, and we've been able to do a whole pile of things. Projects around recognising patients at risk of dying is being wrapped up during this time. We've been looking at dementia-friendly emergency departments, innovation to prevent falls through mobility, and grief in older people and its effect on healthcare use has actually been conducted during this time. And that's been an interesting project. And we've got new projects on e-learning for staff working in aged care. We're going to start looking at outdoor activities in residential aged care services, thinking about reducing sedentary time, and also looking at some of the effects of care partners during COVID in relation to people in residential aged care services. All of these projects are co-designed. So that's like the fundamental process, and there are always carers involved. We recently launched our research centre. That's been a really great thing. It's taken 6 months during this really tricky period of time to get it up and running, and I guess not many research centres are getting established and being given millions of dollars in funding when many other universities are bleeding. I don't know what's going on with that. Oh, here we go, that's all come. I'm in charge of the workforce development research team, and that's really looking at innovation in evidence-based education, training and support. So this is kind of a new frontier for me, and together with my colleagues, looking at new ways we can provide workforce training for pre-registration students and postgraduate students, and also some organisational programs around health and aged care. And this is my favourite one. This is one that came from left field for me. I'm in this band called The Critics. In 1982, we recorded an album. It was never released, and somebody heard our music at the beginning of the year, and he decided he was going to get our work remastered and pressed on vinyl. And we're launching that album in December. So look, 2020 has been like a wild ride in Victoria, but on a personal level, some very interesting things have happened. So thanks for that.
And I got a early cut of that CD, and it's pretty great. So Danny might be retiring from academia to become a rock star later in life. And we all saw him first, guys. Anyway, now we'll leave Melbourne and we'll travel over to our friends in the little red dot of Singapore, where Tamsin's going to give us an overview of what happened there. And Singapore was one of the first countries after China to be really impacted by COVID. And I think we all watched thinking, wow, Singapore is doing a great job. They're really locking this down. They locked it down and it came right back. And I think after the Singapore experience, we all realized this thing wasn't going away quietly. So I'll turn over to you, Tamsin, to give us an overview of what was happening in Singapore and from your perspective in design and health innovation, what you saw as the key takeaways from that.
Thank you, Lisa. I'll try and get my slides up. Yeah, Danny, thank you for that. So interesting for me as well, coming from a different country's perspective, to see how you guys have been grappling with things on the ground. Let's try and get these slides sharing. I'm focusing slightly differently on some of the design responses we've seen. Okay, I'm hopeful. If anyone can put a thumbs up if you can see that. Yay, okay, that'll do. Lisa, yes, okay, great. So I'll quickly run through. For those of you who are listening from Singapore, you'll have seen there have been a lot of really interesting responses to this year's situation from different areas. And I just thought I wanted to flash some of those out because I thought it's great to celebrate some of the good things that have come out of a quite challenging year. And just in a similar way, but less detailed, I'll do the high-level version of some of the COVID-19 story. And I'm going to start with part one. Yeah, 22nd of January this year, we had a multi-ministry government task force established, and it was deliberately multi-ministry, so we didn't just look at the healthcare lens, we looked at different areas of potential impact. I remember my first meeting of the year, right at the beginning of January, was in one of our hospitals in Yishun, and I was meeting with the COO, and she came in late, she quickly rushed, and then she said, "I'm so sorry, Tamsin, I can't stay. We're already preparing for this pneumonia in Wuhan, we think it's coming." And I was thinking, oh God, I've just come back from my Christmas break. I think I didn't even know anything about it. Wow. it was an interesting conversation. On the 23rd of January, we captured our first case. It was a 66-year-old visitor from Wuhan. He traveled with a large family group, some of whom went straight on to Malaysia and started spreading the disease there. And this poor guy, he was picked up early, but also inadvertently spreading the disease, and some of his family members were. So that's how it began for us. But in the early days, it was still quite manageable. And it was quite interesting to me, the way the information was shared. We all became avid consumers of COVID-19 information. Every single new case that came up, it was all confidential, but we would have patient number 3. Patient number 3 is from Navina. And on the day that they would track, they went to these places, right? So you're quickly checking, have I been there? Have I been there in the past couple of days? We became avid consumers of information about the disease and how it was spreading. And one of the great responses that Singapore had was this track and trace effort. And it employed so many hundreds of staff from across government, starting through Ministry of Health, who would phone up the patients and try to track through all the places they had been and all the people they had come into contact with. And then they would check on those people to see how they were getting on. And in this way, we were able to start linking what seemed to be unconnected cases and create clusters of information around the disease outbreak. This helped us really understand how the disease spread and how to start containing it. So those early days, I look at this headline and I was like, wow, 3 cases. And that seemed like a lot at the time. And we thought, oh, this terrifying disease is coming. And how little did we know. The other interesting thing, there were a lot of digital responses in Singapore, and one of the interesting things that emerged was this ability to, from a consumer point of view, track where the cases were, and again see geographically how close they were to where we lived and whether we'd come into contact with them, and so on and so forth. So there was a lot of that happening as well in these early days. By the 7th of February, the government lifted our disease control level to DORSCON orange. I'll not go into all the details of that, but what it meant was the government saw that the cases in the community were rising and decided we would tighten our controls a little. And so public events were cancelled. We had to limit activities that we were involved in, cinemas closed, and so on and so forth. So the situation became more serious, but we were still going to work, we were still going to school, and we were still able to go out to restaurants. And actually, by the end of February, we kind of maybe were getting a little bit confident. Cases were really dropping down. We thought, yeah, okay, we've got this. Well done, Singapore. All our great effort, we've got this under control. Prof. Tan Chor Chuan here, a good work colleague of mine, came out around the end of January or early February to say, let's not be too optimistic here. Yeah, guys, I don't think this is done yet. And of course, it turned out he was absolutely right. It's interesting to me to look at the role of design through all of this. And I put this photo up because I wanted to show that actually not all the design responses in Singapore have been particularly elegant or beautiful, but many of them really understood human behavior. We need to keep people apart. So let's just put tape over all the seats we can find so they don't congregate and cluster. Okay, so that was a crude starting point, but it showed that there was a real understanding at grassroots level that people like to cluster. So we got more sophisticated, nice stickers. Come on, we're in this together. Let's separate each other's out on trains and on MR and on buses so that we don't, sit too closely to each other. And we still have these measures in place now. And then, of course, in Singapore, we start looking at technology solutions. So I don't know if you can all see this, Spot the Dog, the robo-dog. This was one of the innovations that came out that NParks, our National Parks Agency, introduced. This is an AI-powered dog that runs around the park and barks social distancing orders to people if they get too close to each other. If they come within 6 feet of each other, the robo-dog scares them away. But of course, there's a huge design flaw with this. Yeah, I'm sure you can all see it straight away. Wow, robotic dog, let's cluster around and take photos. So again, we see these iterations all the time, and that's a wonderful thing to see, but we're still learning. And that's what I love about Singapore. We're permanently learning and open to improving. In terms of some of the clinical solutioning, there's been a lot of really interesting innovation, and I think you'll have seen this in the countries you're from as well. This is one of the innovations that actually came from the Centre for Healthcare Innovation located at Tan Tock Seng Hospital. And in fact, kind of interestingly, we already had a National Centre for Infectious Disease that had opened only the year before. That was partially in response to the SARS outbreak here in 2003. We have an amazing dedicated infectious disease hospital. So we were able to very quickly handle the cases and deal with screening. So although we had a big caseload, we were really set up. And in fact, all the hospitals are geared up to deal with infectious disease outbreaks. So that was one of the advantages we have. This was a very simple innovation. Yeah, it was 3D printed within the Healthcare Innovation Centre, because with all the staff wearing so much heavy PPE all day, every day, they were suffering. The goggles that they had to wear were misting up because they were wearing the masks. The masks were placing pressure on the ears and the nose, and it was very, very uncomfortable. But of course, the frontline healthcare workers need to be protected from the disease. So they 3D printed a flexible face shield that allowed the goggles to not have to be worn and reduce the pressure on those pain points. So it was a simple thing. Interestingly to me, it was an iteration of a previous design that they had prototyped back in the SARS outbreak in 2003. So the iterative process is quite strong in Singapore. This shield was developed in 3 weeks, and 150 pieces have been distributed in the first 3 months. So it moved quite quickly. And then a similar take on this came from Unteng Phong Hospital on the west coast of Singapore. They realized that for patients in the intensive care unit, they needed to be propped up, but it made it difficult. That alleviates the pressure on the lungs. It made it difficult to contain the aerosols, and therefore there was an additional exposure risk to those frontline healthcare workers. So they've developed this rather scary looking contraption. It's a detachable 3-piece box shield, or as they call it, a BIO-AEROSOL containment unit. And it's very easily dismantled and re-erected, and it fits around the patient. It allows the intubation to happen It has a suction tube to take the contaminated air out, and it creates this safe bubble for the patient. Now, apparently it was also designed to be large enough that it doesn't cause any sense of claustrophobia, but as I haven't stepped inside one, I can't confirm that. The other big benefit it had was that it was specifically designed to fit onto the ICU beds and the transfer beds, because one of the big risks they found for patients being transferred from ICU to other parts of the hospital is that flow of aerosol particles. And the original approach they've been using was to have a security guard walking in front of each trolley bed and a cleaner following behind. So they had to have this big procession of people to try to protect all the other users of the space. By using the box shield, actually, they were able to take away that resource because it self-contained all the particles. So it had quite a big impact in terms of productivity and efficiency as well as health. And then, of course, we come back to technology in Singapore. We love our robots. This was something called SwabBot. I don't know, it's a bit of a scary name, I think. But, you know, I'm lucky, I haven't had to have a COVID-19 test. But from all the videos I've seen and the anecdotal feedback I've heard, it's not the most comfortable experience. And it can be quite time consuming for a swabber to get the collection from a nasal cavity if the patient is concerned. So SwabBot apparently has been designed to overcome this. SwabBot can be controlled by the chin of the patient. So if they can control a certain amount of movement with their chin, but also if they feel too uncertain, they can pull back. But actually, it seems to be much better controlled than a manual scraping out of material. So the process tends to take a lot shorter time, 20 seconds apparently. It's far more reliable process. It brings a higher yield, and it allowed that there's no dipping of performance because SwabBot doesn't get tired. So this was something that clinicians at the National Cancer Centre, Singapore General Hospital, and Duke NUS Medical School co-designed with a local company called BioBot. They developed this in 3 months to working prototype level, and it's up and running now. So we always need a tech solution in there somewhere. So quite a range of clinical responses we've seen there. But I also wanted to quickly stop and look at community health. Initially in the pandemic, all focus, of course, was on acute healthcare and how we contain this and how we treat the sick and so on. But actually there was a big impact on the wider community. Senses of well-being and needing to protect the community from the disease were really also very important. And I always laugh that the word pivot seems to have a huge resurgence this year, huh? Is it just in Singapore that we've heard the word pivot, pivot, pivot? So it's moved from engineering into general terminology. And it's been amazing to see the number of companies locally that have pivoted to respond to the impacts the pandemic has created. So I shared just one example of the many. A fashion manufacturer, Gimli Group, partnered with Nanyang Technological University to create antimicrobial masks. So these masks are infused basically with a naturally occurring compound that's antibacterial. And they were quickly manufactured and distributed to all Singapore citizens. So the government funded that to go out to all the population to try to protect them. The interesting thing to me, again, when we think about iterations and the serendipity of the design process, which of course is so much harder when we're doing everything online, is that this innovation actually tumbled out of research in food science. So it was looking at the discarded seeds through food manufacturing. They discovered they had antimicrobial properties, and they started to see if they could put that into fabric, basically. So another really interesting, unexpected iteration. The other thing that's been amazing for me to see are the grounds up, very ad hoc efforts to design solutions. So as with most countries, we had a bit of a crazy time at the beginning of the outbreak with all the shops selling out of everything you think you need to survive. It started with toilet paper and quickly progressed to rice and then sanitizers and antibacterial anything. And we really had run out of sanitizers in the country. I think some people must have had a lifetime supply hidden away in their back rooms, and others had nothing. So there was an amazing effort amongst lots of community members to start making their own sanitizer. Between you and me, I'm not sure how effective it was, but do you know what? It was a wonderful effort to say, we recognize this is a concern and we want to do something. And that to me was the very powerful thing. And a number of platforms opened up as well to support and facilitate some of this. So A Good Space is one example. A Good Space already exists. They're participation designers who work with local community groups to help them understand and build empathy skills and design solutions for local issues. They created a platform to crowdsource problems that people were identifying in their communities as a result of the pandemic. And they connected people who were passionate and wanted to make a difference to these problems. And they would look for how they might solution and create responses there with their design facilitators. So lots of different grassroots rising solutions coming out of this, as well as all the high-tech ones, which has been really heartwarming to see. One of the things that we were involved in at a Design Singapore Council, and in fact in my previous role at NUS, where I started the project, was this Design for Impact Designathon. This was an effort to really support those grassroots ideation processes and see if we could help tackle some of those urgent issues in a neighborhood by bringing people together, coaching them through design thinking program and seeing what solutions they could come up with. The aim was to find community-owned initiatives that the community could then be supported in taking forward. So that's one of the many kind of approaches that took place. This all had to be run online. So of course, for people who've never been exposed to design thinking before, that's also a bit of a challenge to learn. We had to teach them how to use Miro and in some cases, how to use Zoom. And some really nice responses as a result of this. The amount of funding wasn't great, but it was enough seed funding to get them moving. And some of the winning ideas included something like Kit Box, which was a monthly healthy living subscription box that has like healthy nutritional materials, foods, exercise ideas, and art therapy kits for the seniors to try to keep them healthy each month. Block Bingo, which was a gamified challenge between public housing residential blocks here in Singapore to encourage safely distanced active lifestyles. They recognize that for a lot of people, and Lisa, we talked about this earlier, for people living in our small housing development block apartments, actually becoming active during our circuit breaker, our lockdown period, is quite tough. So these were some of the ideas they had to try to bring people out of their homes, but in a safe and managed way. And then things like Buddy Aid, which is a digital app to connect socially isolated seniors post-hospital discharge with volunteers who would engage with them on a daily basis and nudge them to follow their care plan. So quite a variety of ideas that are still being driven forward now. I'm very briefly going to just come back onto our cases in Singapore. So it's sounding great over here, yeah? But by April, we realized our cases were really climbing. We had increasing number of community cases, but also we started to detect we had a big problem in our dormitories. So in Singapore, we have a lot of short-term pass foreign workers who tend to work in construction type roles or manufacturing. And their work passes are linked to their employment contract, and their accommodation is also linked to that. So the accommodation is provided by their employers. And so therefore their employers look for, let's make cheap, cheerful accommodation, and they tend to be in very crowded dormitories, maybe with 20 people per room. And so that was, and I think, to be honest, this second wave that took place throughout those dormitories that house around 300,000 workers was a real shock to Singapore. Number one, it was a shock because we'd been blindsided to it. Yeah, all the focus was on, and this is where the empathy comes in. It was focused on looking at how I live my life. And most people who are designing the solutions in Singapore don't live in dormitories. In fact, I don't think any of them do. So they're quite blindsided to that, and they hadn't really been solutioning around this. And hence we had huge outbreaks in our dormitories. And I think the second part of that is for most Singaporean citizens, there was a sense of guilt that this had been allowed to happen, a sense of guilt that they'd turned a blind eye to the housing conditions of these workers. So there were lots of immediate actions taken. Our number of cases grew dramatically over this period of time, and hence we went into something called circuit breaker, which you'd more commonly understand as a lockdown. We went into initially a 4-week lockdown, and that was extended because the situation wasn't under control. So our lockdown was extended. For the poor guys living in the dormitories, they had a really severe example of it because they really weren't allowed to leave their dorms. Every single dormitory resident was tested, and the disease was really brought under control, but the conditions for them were really brought into sharp focus. And one of the wonderful things, and the reason I really bring this up is because one of the wonderful things that's come out of this is that hopefully we're looking at improved conditions for our foreign workers as a result of the pandemic. So on the 1st of June, the government made announcements. The Ministry of National Development and the Ministry of Manpower made an announcement to say they're going to invest in improving standards for migrant workers, which is a wonderful outcome. The quote I have here: "We aim to make dormitory living and design more resilient to public health risks, including pandemics, with improved living standards that are benchmarked internationally." In other words, we want to be proud of the way we care for our foreign workers, but also interesting to me that we've gone back to looking at public health and the design of our housing as a result of this. So I feel this to be something quite powerful. And the designs are already starting to come out. This is quite a gorgeous looking design. If you look at the dormitories that the workers are currently living in, which kind of these stackable metal huts, this is quite a beautiful design that's come out of one of our local firms, Kingsman. So they've really tried to think about the kind of needs the accommodation would have, with prefabricated modular structure so that it's easily adaptable and assembled quickly and could be accommodating other needs. It's low density housing, and it also has biophilic design. So there's lots of plant, there's lots of natural airflow, and that's designed to try to minimize the spread of airborne diseases. They've got all the vegetated facades to provide natural shade to keep the temperatures cool. And they also recognize this need for connectivity. So they've tried to look at how they can bring connectivity in whilst minimizing opportunities for overcrowding. So some really interesting design responses at this level too. Where are we now? Hooray! Let's not count our chickens, but thankfully our numbers seem to be coming under control. We've learnt the hard way that we can't be complacent, so we don't believe the fight is yet over, but at least for the time being we appear to be in a manageable situation. Wonderful milestone on 13th of October, which was we had no community cases in Singapore, and that was the first time since March that we'd achieved that. We do still have cases coming in, but they generally are now imported cases, and they're immediately taken from the airport into a hotel, dedicated hotel facilities for 14 days stay home notice. And we've just introduced a new rule that you have to be tested before you leave the country you're flying in from. So my daughter will have to do that in December. Let's just hope. She's living in the UK, so I hope she hasn't gone out and mixed with anyone in the previous weeks. And we also have this exciting milestone that we now have a travel bubble. From the 22nd of November, we've created a travel bubble with Hong Kong. So for the first time all year, or first time since the pandemic really broke, we can go on holiday. So, but only if you're rich, because I think economy fares to Hong Kong have really skyrocketed. So, but it shows that they're starting now to test. They will take one flight a day with 200 passengers on it in each direction. And so very cautiously we'll test that and effectively are prototyping the approach to see how it works. So even at this level, we're still looking at quite a design-led solution and how we can iterate that as it goes along. I just wanted to finish quickly with a couple of initiatives we have at Design Singapore Council that are aiming to maintain this appetite for impact design that's really grown through the pandemic or become more evident. And one of them is a fund we've created called the Good Design Research Initiative. And this funds local design firms to think about how they might pivot, how they might reimagine their services to provide something that's more relevant during this period. And so we've had some great results on that already through the first tranche, and we're just launching the second tranche. So some really exciting local design opportunities to create impact there. And then, of course, I have to end with my own little initiative. You're all welcome to contact me if you want to learn more. School of X is a real-world learning platform that's designed to help bring together citizens and organisations to solve issues that matter to us. So these might be anything from littering in a common area to how we engage socially isolated seniors during a pandemic. So we've just finished one of our first projects, which has been wonderful, working with the Centre for Fathering here in Singapore, looking at how they can become financially resilient into the future. Because one thing to mention during this year is that for some non-profit organisations, it's been a very, very difficult year. For those helping people who've been acutely affected by the pandemic, they've managed to secure good charitable donations, and people really have been generous during this year. But Centre for Fathering is a preventative care type of organisation. It focuses on building happy families rather than supporting broken families. And as a result, their fundraising dried up quite substantially. And what the year has brought into focus for them is the fact they're not really in control of the way they strategically plan, because they're not in control of their finances. So they've come out with some amazing ideas through this 6-week program we put the people through. People with no design background who've come up with ideas that Centre Fathering will be operationalising in January across the country. So quite exciting. Feel free to contact me if you want to know more. Thank you so much. I'll stop now.
Thanks, Tamsin. Yeah, once again, really amazing that we've evolved so quickly, and also that it's so exciting for people from Singapore to be able to travel to Hong Kong. Who would have thought? That's just such a regular route that people go back and forth all the time. So it's really changed our perspective on, I know for me, I was unable to visit my mother-in-law who lives 2 hours away from me in New South Wales. And it's been a big thing for us to be able to travel across the Queensland border into New South Wales. So we've all had to pivot, as you say, to these new normals.
So it's very interesting, yeah.
Yeah. So now we'll travel to Dubai, where we'll talk to Carlos. And actually, Carlos and I were meant to run a workshop in person in Dubai in April on design for healthy aging, which we started to rapidly realize might get canceled as every single other event was getting canceled. As universities started to say, don't travel anywhere, we won't insure you. So hopefully someday I'll get to visit Carlos and see Dee Dee. But in the meantime, Carlos is going to share to us how they were innovative in the way that they developed their design school to totally function and respond to the pandemic. So Carlos, take it away.
Thank you very much, Lisa. And first of all, I want to really say thank you to all the people that are here with us. It really is a celebration with many, many friends. And I would like to acknowledge that we have the president of our institution, Mr. Mohammed Abdullah, and we have also our dean, Hania Sfour, and we have some of my current colleagues and even some of my students, which I'm very, very happy that they're here. And again, thank you for that. And of course, the people from the University of Canberra Industrial Design and from the National University of Singapore Industrial Design. So really, really great to see you here. So I'm not going to concentrate so much on what happened on the pandemic as such here in Dubai, but basically I'm going to talk a bit more about some of the government initiatives and especially what we did as the Dubai Institute of Design and Innovation. I have to say that in Dubai, the government did react very quickly. We went into lockdown very quickly, and it has been managed very well from my point of view and compared to what has happened in other countries. We moved also to online learning very quickly, as all of us have done. We have drive-in testing, and we've developed some very strict measures to try to control the pandemic. Now, I'll basically tell a bit of who we are, because we're so new that we need to shout it to the world, and talk a bit about design and innovation for health in the UAE, and some of the projects and collaborations that we've developed around the topic of design for health, and especially in view of COVID. So first of all, the IDI, or the Dubai Institute of Design and Innovation, is the first non-for-profit private university in the region that has been established in 2018. We basically started teaching in September 2018. So we're currently in our 2.5 years of teaching. We have 3 cohorts of students. And the IDI was basically established to address the need for designers and innovators in the MENA region. And MENA stands for Middle East and North Africa. And we believe that the future of design is experimental, transformative, disruptive, and cross-disciplinary. Our curriculum partners are MIT and Parsons. And again, MIT probably were the top university in terms of innovation. And Parsons, the new School of Design, also ranked as one of the top schools of design in the world. So we have received a very, very strong curriculum focused on technology and focused on innovation, but also with business. And we're constantly transforming it to the needs of our region. This is what we call the DNA of the IDI. So basically, we have 3 main areas in which we focus. We have visual literacy, technological fluency, and strategic proficiency. And at the core of these three areas, we have what we call the 4 C's, which is to conceptualize, craft, communicate, and care. And care is very, very important for us also, because we do believe in human-centered design, in user-centered design, and of course in design for good and design to care for our planet. So design for sustainability is also a very, very important focus of our university, as is design for social good. Now we're really careful in mixing these three. So the visual literacy, of course, probably the traditional approach to design, emotional design, all the visual elements, tactile experiences, aesthetics. Technological fluency, very, very important, because we understand that this is the future and we need our students to be able to code and know about robotics and be able to implement that. And the strategic proficiency, also very important, because we have seen the changing role of design from a cosmetic discipline where we decorated in a way some products or some environments, to a more strategic role of design where we're collaborating with the government, we're developing policies. And this is a bit of the structure of our curricula. So we have a 4-year bachelor's degree. In the first year, we have the foundation program, which prepares the students in this multidisciplinarity. And then our students in their second year have to choose 2 of 4 cross concentrations. And the cross concentrations are multimedia design, fashion design, strategic design management, and product design. And we believe that these combinations will allow our students to really develop some innovative skills for the future. So combining product and fashion, or multimedia and fashion, multimedia and strategy, fashion and strategy, strategy and product, or product and multimedia. Because again, the problems that we're facing now and the problems that we will face in the future are problems that are very complex, and that we cannot look at them from a silo or from a unique perspective of one discipline. We really need to think of those problems in terms of interdisciplinarity, cross-disciplinarity, or even transdisciplinarity, going beyond the disciplines. So here's what we foresee that our students might be doing in the future. And I have to acknowledge that most of this is the work of our Dean, Hanias Four, who prepared this presentation actually, and he prepared the curriculum structure. And for example, if we combine product and multimedia, we could see our students developing IoT furniture, smart furniture. If we combine product and fashion, our students would be very well prepared to develop wearables. If we combine multimedia and fashion, we could talk about interactive clothing, new materials, smart materials that communicate. Multimedia and strategy, definitely blockchain interactions, fashion and strategy, ethical fashion, strategy and product management, strategic management, chief design officers, and many more. So of course, we believe that design is at the core of the 4th industrial revolution, but we know that we need to mix it with a strategic approach and a strategic mindset, and with businesses, but also with a strong knowledge in technology and engineering. And in the end, we are an institute of technology. And in a world where blockchains and robots will be the norm, we want to future-proof our students and the jobs they will be doing. And we know that many of the jobs that we have today will not exist in the future, or they will completely change. And we also know that these new technologies will bring absolutely new jobs that we're just starting to imagine. So we have tried to imagine what could be those jobs of the future. Of course, in this panorama, the idea of entrepreneurship is also very important for us, because we're training designers not just to become employees in industry, for example, but really to start their own companies and their own businesses. So specifically in the area of healthcare, of course, we foresee, and that's already happening, that our designers will be smart health systems designers. So really looking at the complex problems and from a systems point of view, and how all these elements are interconnected, and with a very strong support from technology. Or even, why not human organ designers? So nowadays we see that all these advances in virtual reality, 3D printing, new materials, biomaterials, and biotechnology. So one of my other topics is biomimicry and biodesign, and we are seeing that the possibilities of merging biotechnology and biodesign with these new technologies is just amazing. So what if we were to design new types of prosthetics, new types of bones, new types of tissues? This requires a completely different mindset. Now let's look a bit into the design and innovation policies or environment in the UAE and how this affects health and what is being done in the health areas here in the UAE and specifically in Dubai. So we do have the UAE National Innovation Strategy, the NIS, and it aims to take innovation in the UAE to new heights, where a culture of innovation is embedded amongst individuals, companies, and governments. It primarily focuses on identified priority sectors that will drive future innovation. And the framework is constituted around 3 pillars: an innovation enabling environment, innovation champions, and innovation priority sectors. And this is where we as a very new institution are trying to focus our efforts in terms of the research that we're starting to develop. So the innovation priority sectors are basically clean and renewable energy, of course, related to sustainability, transportation, technology, education, health, water, and space. And specifically in DIDI, we're working very much in technology and the humanization of technology, education, of course, because we are an educational institution, health, because it's one of the topics that we see is very important all around the world for our well-being, and aerospace, because also here in the UAE, there's a very strong push for the aerospace development and colonization of Mars and looking at what life can be in other planets. So we are somehow hybridizing these research tracks. And also specifically in terms of health, there is a major push for some innovation, especially in the area of pharmaceuticals, biotechnology, life sciences, telemedicine, robotic surgery, and smart health. We also have the Dubai Health Strategy 2021, which is almost going to expire, but it's been going on for 5 years, since 2016. And at that time, Sheikh Mohammed launched the Dubai Health Strategy 2021, which features 4 main approaches, 6 objectives, and 15 programs with 93 initiatives, all of which are set to achieve a leap in health. The 4 approaches are health and lifestyle, excellence in providing service, smart healthcare, and governance. And I have to say that especially the idea of excellence, excellent service and smart healthcare are very, very strong, because Dubai is a city that is really, really pushing the idea of smart cities and is completely digitizing its services, is completely digitizing the government institutions, and it's really pushing it. And of course, excellent service is also very important, because this is one of the main economic aspects, and the idea of health tourism in Dubai and the UAE is something very important for the economy and has been also pushed. So some of the objectives include ensuring a healthy and safe environment for Dubai's people, ensuring the provision of high quality, comprehensive and integrated health service systems, achieving innovation, improving efficiency in providing healthcare, creating an integrated database to be used for the smart government policy in taking decisions, and creative and effective ecological system for the healthcare sector in Dubai, and in collaboration with private and public sectors. And this also just to give a background of what these policies are and how we as DIDI have tried to address them, linking with industries and the government to develop some of our projects. So now I move to some of the projects and collaborations that we have developed. Since 2019, we signed an MOU with the Mohammed bin Rashid University of Medical and Health Sciences. And this MBRU University is also part of this initiative from the government to develop further the healthcare systems and the healthcare sciences in the region. The MBRU is also a very new university, probably 5 or 6 years old. But again, together we're collaborating to be able to grow as universities. So initially, as part of one of our courses, which is Design Strategies and Entrepreneurship, which I teach in the first year, we got the people from MBRU to pose some challenges to our students. And they came with, they explained some of the medical challenges, some of the health challenges, both locally and in the region. And we had some of our students put their proposals around it. And they had to prepare a business proposal because the course is around entrepreneurship, but also a service design proposal and the whole strategy to develop it. This project, HAIL, was developed by our students Aditi, Maha, Amber, and Nikki. And basically they were visualizing decentralized systems for hospitals and patient data. And this was basically done by using blockchain technology. This is another very interesting project. I personally like it very much. It's very close to my heart, and it's Yala. So our students identified that there is a problem here in the UAE with teenage obesity due to many factors, basically nutrition, lack of sport, sometimes due to the high temperatures and being most of the time indoors. And this was enhanced or worse with the lockdown, of course. So in this case, our students proposed this business model and this idea of creating an app, and not just an app, but really a whole system to get together teenagers to do different types of sports. And they thought of partnerships with the Dubai Sports World, the Dubai Health Authority, and the Dubai Sports Council. Now, this, of course, as usual, we do in service design, and they proposed an app with all the interface. And this one is also very interesting. I'm not going to talk so much about it, but what I love of this project is that when I read it, I thought, oh, you developed the iCup. And the students told me, no, it's the ICUP. And it's a business proposal to improve urine tests. So it just shows that our students also have great sense of humor while they're developing some of these design solutions. In this case, it was a proposal to make easier and faster and maybe even remotely the collection for urine tests. We also developed the Design for Health Bootcamp, where we got together students from DIDI, MBRU, and AUS to work together to co-design innovative solutions to address the regional and local healthcare challenges. And basically here we managed to get together 3 universities and 3 hospitals. So DIDI, MBRU, the Mohammed bin Rashid University of Medical Sciences, and AUS, the American University of Sharjah. Our DIDI students were basically our design students, first year students at the time, very motivated. MBRU students were students of medical sciences, and especially doctors and nurses. And the American University of Sharjah students were engineering students, IT students. So we got these students together and we put them through a 1-week workshop where we took them to talk to the people from both Mediclinics and the King's College Hospital to really understand the problems that they were suffering. And usually it was around the customer and the final users and customer experience. And they developed some of these solutions, which some of them were actually implemented by some of these hospitals. And then COVID came, and we were all a bit in panic. All of us, none of us knew what to do. And sometimes when I speak with my friends, we say we're all navigating in the blind, because every time, as some of you were already saying, there was new news, and some people said that we should wash all our food and take our clothes and disinfect absolutely everything. And then we received different information. I think it's been really, really an experience of information overload also. Very, very strong experience, really a historical moment. And in our school, we thought, okay, if we look into the future and we think we lived through COVID, we would ask ourselves, what did the IDI do? And there's where we developed several initiatives around COVID-19. This diagram was again summarized by our dean, who is our visual genius. And basically it shows two main areas. The area on our left is the people and the faculty that wanted continuity, and wanted the continuity with the curriculum and continuity with their studies, the students that wanted continuity with their projects. So we, of course, allowed this, and we said we're going to reflect on what the process is, or we're going to design by inhabiting or by living this experience, and we're going to collect data. But we also had another point of view, which were faculty and staff that wanted to contribute and wanted to do something very quickly to support the people here locally. And here, this was actually a student-led initiative, and many of our students, some students that are now studying design and previously studied medicine, and many of our activist students, they were really eager to do something. So we, with my amazing colleagues, Renata Moraes and Sejal Patel, we co-founded the Agile Factory. And we basically started with collaborative vertical studio, where we mixed students from our first and second year to work on some of the problems that were posed by COVID. We also had some initiatives around the remote Fab Lab, and our Fab Lab manager, Simone, is also here with us, and thinking around, okay, if we're in lockdown and we know that our design students rely so much on prototyping, how can we do something around this, and how can we support them? And then we started this idea of the remote Fab Lab, where we prepared some pre-made kits for the students to be able to develop some of their projects at home. And we also started creating a network for them to be able to 3D print from home. We explored some ideas, for example, using the food delivery motorcycles to deliver the prototypes to our students. It was a very, very creative effort. And this is the summary of our Agile Factory. We have a website, and we have some papers where we discuss our responses to the global pandemic. And we basically had three main projects. The first one is the Open Data Interfaces project, the Design for Emergency project, and the Hacking Manufacture project. The Open Data Interfaces project was specially developed with multimedia students, and basically led by Renata, our colleague. And the main project was called the Constellation of Remembrance. And this is a very beautiful project, and a very poetic project, because here the students were thinking, if we're all in lockdown, what happens to all these families that their members are dying and that they cannot mourn their family, or they cannot honor their family? So what can we do to create this to be able to take the culture of grief and of mourning, but maybe to bring it to the digital space, to the digital world. And how can we remember our loved ones if we don't have the chance to say goodbye to them in person? A really, really beautiful project. It was also developed in collaboration with Melbourne University. Another one of the projects was co-live and design for emergencies, so more around service design. And here our students prototype a digital platform that serves as an online interactive community and emotional data repository. And as we were discussing, the whole idea of mental health has been really a challenge, and it was especially heightened during the lockdowns and during social isolation. And this is even worse when you think about teenagers or very young adults that are willing to be in the university, willing to socialize, and are suddenly constrained to just be at home, sometimes under difficult family situations. So here our students proposed several episodes or several areas to try to document what has been happening. So we have the Facing COVID episode, the New Normal episode, the Mental Health episode, and the Coming Soon episode. And we have this in the websites. They actually recorded some really, really interesting evidence and some really emotional documentation of what they were facing during the lockdown, what they thought, what they felt, what they saw, an immense exercise in empathy. And we know that empathy, of course, is at the core of what we do in design. And the final project of the Agile Factory was Hacking Manufacture, which I personally led because it was the most, let's say, industrial design or product design related project. And we developed easy to manufacture and assemble face shields that could be made locally and that could be donated to our healthcare workers. And this was actually a very, very challenging project because we were all working remotely. So of course, with this new mode of working and just with communications through WhatsApp or maybe some Zoom and MS Teams chats, the whole idea of materiality and discussing materials and forms and not being able to touch and feel some of these elements created many, many challenges, many miscommunications. But nevertheless, we managed to overcome them, and we managed to propose two different solutions. One, which was this one, which had a message also for the healthcare workers, and again, including very much the emotional aspect of the whole situation, not just the very functional aspect of protection. And in this case, the innovation is very small, but through the research, our students discovered that some of the healthcare workers wanted their ears to be protected. So that's why they developed this bigger shield. And then we developed another version, which was to optimize the amount of material and to optimize the manufacturing process. And this was also a very, very beautiful process because everybody in our institution collaborated. So of course we had the support of the leadership, and even more so, for example, our dean designed the graphics for the assembly instructions. Our students, of course, did all the work and all the design work remotely, but our Fab Lab manager and technicians did all the prototyping many times during the weekends, late nights. It was just an amazing, amazing effort. We also had, for example, our guard assembling some of these and packing them. It was just an amazing collective effort. And then we managed to develop, to manufacture a small batch of these face shields, which were donated to the Dubai Health Authority. Now, some more recent projects and collaborations, especially around the area of health, but also very, very influenced by COVID, are these. So currently we're working with Vital Probe, which is a startup that has developed some wearables basically to monitor health. And they monitor the ECG, heart rate variability, body temperature, sleep tracking. They have position tracking. They're tracking many vital signs. And currently with them, we're doing the product design development. And in the future, we will hope to also do the usability testing and research and develop the UX UI. And again, this is part of our efforts to engage with industry and start generating research that is very much supported and financed by industry. We also have been working very closely with Smart Dubai. And Smart Dubai is basically the agency that, in a way, guides all the government institutions to become smart and to digitalize, become paperless, and use all the new technologies to improve their service. They have a very beautiful project, which is the happiness agenda, and they want to make Dubai the happiest city in the world. And based on that, they did some very deep research around COVID-19 and what had happened during the time. And this research was published as a report, the City Experience, Resilience, and Impact Report. And together with Smart Dubai and also the University of Dubai, we're finalizing the teaching of a service design professional diploma for government and industry managers. And here, basically, we've taken all these findings of what happened during COVID-19 and trying to get the managers in the government to use design thinking and to use the ideas around service design and user-centered design to improve our lifestyle. Some of the key topics that have been developed are remote working, of course, a new work culture, overall well-being, information clarity, quality as strategy, digitization, enabling technologies, and the resilient city. And we are also now in the second phase in this collaboration with Smart Dubai. So hopefully we will also integrate Fjord Accenture to develop another project with our students in the next academic year in 2021. And finally, we recently started a collaboration with Motus Science. So interestingly, the founder of Motus Science is one of my high school friends, and he currently lives in Melbourne. And he's a graduate from MIT, an engineer, and he's with his team and with the company, they're developing artificial intelligence-powered COVID trackers for many cities. They have already developed the Victoria and Melbourne tracker, and they're also developing a tracker for Bogota in Colombia, my country of origin, and together with our multimedia students, and again, led by Renata Moraes, our multimedia professor, we are going to develop together a COVID tracker for Dubai. So this is currently what Motus Science offers. And again, this is a very, let's say, engineering and technology focused approach. But what we're going to do collectively is that we're going to take our design students and we're challenging our design students to improve the interfaces, to improve the overall experience, and maybe to look at what is going to be especially particular in the culture of Dubai and the UAE to make such an app and such a tool really work. And thank you very much. That's it from me.
Thanks, Carlos. So it was a fascinating amount of really interesting and innovative solutions to a variety of different health concerns. And now we'll move on to Marina, last but not least, who can tell us all about what happened in Russia, which I'm personally interested in because I think I got a lot of news out of Singapore, and Carlos was updating me on Dubai. And of course, I know what was happening in the US and Australia, but to me, what was happening in Russia was kind of a mystery. So I'd love to hear from Marina about her take on COVID and what it was like to be in Moscow during that time.
Absolutely, Lisa. Thank you so much for this. And I'll be sharing my screen in just a couple of moments. But before that, I just want to thank everyone for their wonderful stories and insights given to us. It's really, really been interesting to get to know what was happening in so many parts of the world. And basically to say that we are not, that different from each other, no matter where we live and where we come from, because as Danny said earlier, we've been on this wild ride, this emotional roller coaster ever since March, I think, when it was announced by the World Health Organization that we are dealing with a pandemic. So, it's been an up and down ride for all of us. Let me just share. Let me try to do this. Okay, so I can show you some of the slides that I have. Can you see it now? Can you see the full screen?
Yes.
Thank you. So yeah, as I said earlier, it's just listening to all of you guys. It's pretty much been the same over here as well, because people have been responding in different ways, and the psychological mood also went up and down. So we've been on this emotional roller coaster ever since it all started. Before I go into telling you what it was like here, I just want to thank Lisa one more time for giving me this opportunity to participate in a wonderful project that so many people took part in. And it was just amazing. For me, it was, as a cross-cultural consultant living in Moscow, it was really great to look at it from the cultural side of things, because I just looked at how these projects worked in different countries where you took the initiatives and you took the students and you talked to different people from different professions and worked together. And when Lisa asked me to share my thoughts on this, I was really, really excited. And I just want to, I put in the slide here what I wrote for the book. And it was amazing. Back then, what was it, a year and a half or so, I couldn't even imagine or anticipate that what I wrote back then would actually be our new normal, our reality right now. So back then I wrote that we may be living in different countries, abide by different cultural rules, norms, and traditions, but what we all have in common is that we live in a very complex reality today, with new technology disrupting our lives, changing our attitudes and values, challenging our beliefs and outlooks. And it was really incredible that I wrote that before the pandemic, before the new normal, as we call it right now, hit us. And I also wrote that yet the same technology brings us all closer together, and no matter where we live and how far geographically apart we are, we can connect within seconds with each other, we can talk to each other, share our thoughts, viewpoints, and give our opinions on things for which we have a shared concern. So just doing this right now is proof to that. And it's really, really amazing that we had this opportunity. I mean, looking at the crisis that all of us are dealing with, I want to kind of emphasize that it's a mixed bag for a lot of people. Some say every cloud has a silver lining, and it's true in some ways, because the crisis brought opportunities to some people and gave others a chance to sort of reevaluate their lives, transform themselves in a way. This is the word cloud that I got when I asked my friends to share their thoughts on what they think the new normal is for them. And as you can see here on the slide, it's all very, very, very mixed. So some people see this period as a way to find new opportunities. Some have found new opportunities. More people are engaged in online activities. When the lockdown was imposed in March, people were, shocked because they didn't know how to deal with the situation. There was a lot of uncertainty. And those who were flexible, really, like professionally flexible, could switch quickly to working online. And there were a lot of people in my circle, because you know, they are university professors, trainers, business trainers, lecturers, and they were used to mixed formats, you know, blended sort of teaching and learning online and offline. So they quickly adapted to the new reality. Some people had some time to adapt and to accept this new normal. But generally, I would say that people were very, very excited about this new reality. But then after a while, the excitement went down because, you know, we realized that working online actually takes a lot of energy and time, takes a lot more preparation than when you're teaching or working offline. Also, engaging with the audience was very, very important for a lot of people, but you cannot see your audience. You can only see like small boxes on the screen, and you cannot, you know, exchange and feel that energy. So a lot of people started missing that a lot. And so, you know, the mood was at that time was going up and down, up and down. So as you see here, some people put the words like uncertainty, fear, emptiness, and then it's balanced with freedom, liberation, kids. Some people started spending more time with their kids and families, more time outdoors in nature. We also have to keep in mind the fact that Russia is a cold country and we have a long winter but a very short summer. So when the lockdown started, it was mid-March. So we were kind of like heading towards the summer, and it gave a lot of optimism to some people because in Russia, let me just show you the next slide, we have this cultural phenomenon called dacha. Maybe some of you have heard of this phenomenon or heard of this word because it's in the Oxford Dictionary. So it's part of the English language vocab. What is dacha? I mean, dacha is truly a Russian cultural phenomenon described in the Russian literature. It's kind of like a summer house that a lot of Russian families have. It could be anything really. It could be big and beautiful. It could be something small, like, you know, some of the wooden huts or like wooden houses that people build sometimes by themselves, kind of like exercising in design and testing their building skills. So it's a way to, Russian dacha is gives a lot of Russians an opportunity to get away from the big cities, to get away from the hustle and bustle of the city life and spend some time away in, you know, the peace and quiet of the nature, breathe some fresh air, which was absolutely really necessary and something that we missed during the lockdown because it was kind of like, you know, really, I should say, very strict. People were fined if they broke the rules, and that too did not create an atmosphere of psychological well-being. So that created tension and anxiety. So the coming of the warmer weather was really, really welcomed by a lot of people, and also the lockdown was eased in April and lifted in May. So that meant that a lot of us could actually leave Moscow, leave big cities, and go far away to the dacha and escape. So the Russian dacha is something that gives a Russian an escape from, you know, the routine of the daily life, and a lot of people welcome that. So that, in a sense, gave a lot of people that I know kind of a psychological comfort, because at that time, I think we were not certain, we were not sure about what was happening, what was going to happen. A lot of people feared that they might lose their jobs, especially those working in small and medium-sized enterprises, or being the owners of those enterprises, because they had to pay the salaries, they had to think about their employees, their staff. So a lot of things were on their minds, and they were concerned about. So that, of course, was a very, very, very difficult time. And a lot of initiatives started back then, grassroots initiatives, the initiatives organized by the government. There was a hashtag, We Are Together, the project that united a lot of people, volunteers, 100,000 volunteers in 85 regions of the country participated in that. So what was it all about? When the numbers began to grow, the numbers of people affected by COVID-19, I think in all countries, the doctors bore the brunt of this crisis, of this escalating situation. And I think we've seen some great initiatives in many countries where people, volunteers, grassroots organizations help the doctors in whatever way they could. And in Russia, for example, there were groups of people who organized food deliveries to hospitals. People cooked food, and people collaborated with cafes and restaurants and organized deliveries to the hospitals where the doctors could eat something, not what they had in their canteens. Of course they had that, but something, something tasty, something nice, something homemade. So that could brighten up their daily lives, because their work, they worked nonstop from morning till night. They worked in shifts. Some of them had to live away from home because they were exposed to the people who were sick. They were working in the so-called red zones, as they were called here, and I think elsewhere in the world. So yeah, they were and still are under a lot of pressure. So projects like this did help them, and also did create the sense of community among people. Also, there were apps designed to help the elderly and those who are less mobile, those who couldn't rely on their relatives to come and look after them and bring food to their homes. So a lot of students participate in that as well, just checking who might be in need of help, where they live in their apartment blocks, in their houses, in their neighborhoods. So, like this, through these apps, they could find out who's near them, who's not so far away from them in, the same part of town, who they could help and bring some food maybe, or go and get some medicine if that was necessary. So that was really great. It was amazing to see how quickly people responded to all these challenges and very complex situations. Another thing I'd like to talk about, which brings the positive element into this whole uncertain situation that we are in, no matter where we come from, is the creation of My Social Center. It's an urban club project, and it was launched in March, ironically, before the lockdown was imposed. At the beginning of March, this project was, as I said, launched and inaugurated. 6 centers opened in the Russian capital. This is an experiment. It's happening in Moscow, but I'm hoping that it will be taken further to other cities of Russia, to other regions of the country, because it's a huge country. But a lot of initiatives start in Moscow and then they spread further. So what is this? This is the Center for the Elderly. The Russian pension age starts from 55, but now we have a new regulation. So starting from, you can become, you can be retired starting from 65, 60 and 65, 64, I think for women, and 65 for men. But yeah, so the retirement age is changing, but nonetheless, anyway, whoever is a pensioner can participate be part of this project, can go to these urban clubs and social centers. They are interesting from the standpoint of design for me, because I've never seen anything like this before, and I'm very excited to share it with you. So there are 6 centers in Moscow. There are 25 more expected to open, and they look pretty much the same. They have 6 recreational spaces, all in the same building, all on the same floor. And these spaces are very different. They are designed to your hobbies and interests. So for example, there's a kitchen where you can have culinary master classes. There is a concert, like a mini concert hall, where you have a piano, musical instruments, drums. And what's really cool about this is that you can actually, anyone can participate. Anyone can say that, for example, anyone can organize a concert. If you're a singer, if you're a musician, if you play a musical instrument, you can organize your own concert and play there for the elderly or for the other members of the community. So it's really amazing how this can work. Oops, sorry. Let me just go back one more slide. Yeah, there are gyms. So physical activity is very, very important, especially after a lot of people have been confined and staying in their homes. And also the media room where the elderly can learn about how to use the internet, how to use webinars, how to take part in webinars, which is very, very important. As I said earlier, the lockdown was eased in May. So from May up until now, we have been breathing quite freely, I should say, like walking around, socializing with people. But right now, it's getting stricter and social activities are a bit limited. And again, we're going back to the online mode. So learning how to use the internet and how to use Zoom, how to use Teams and other platforms for online communication is very important and essential. So a lot of these master classes were organized in these social centers for the elderly, kind of in preparation for the winter, because come when we have cold weather, it's very difficult to do things outdoors, although there are outdoor activities, but nonetheless, there's less that you can do outdoors. And of course, Dacha is only for the summer period. So right now we're heading into winter and colder weather. It's getting a bit challenging how to keep, upbeat and positive about things. So again, we are going through this stage of uncertainty. But, as I like to say, when life gives you lemons, make lemonade. I try to keep positive. I look at the statistic every day just to stay informed. And we get 4,000 to 5,000 cases in Moscow. And for the rest of the country, it's about 19,000, 20,000 cases daily. So it is worrying, but there's little we can do at this point. Of course, there is a vaccine that a lot of people talked about a while ago, but some of my friends have tried it, but there are lots of others who are skeptical about it or cautious about it, I should say. So, we're still facing the uncertain and the unknown. There's just one more picture that I wanted to show of this social club. As I was saying earlier, there are 6 or 7 recreational areas there, spaces. So this is called a QUT living room, where people can play games like board games, read books, or have book clubs. I don't know why it's called a quiet living room, but this is the name that they gave to it. And there are libraries there. So even in terms of design, it's spacious, there are comfortable armchairs. There's enough distance between the people there. So distancing is important these days. Looks quite nice to me. And I've been to some of these centers. I checked them out, and they're all brand new because, this project just started in May. Then it was sort of, because of the pandemic, it didn't get enough coverage in the media, or not a lot of people even know about it. But I hope that more people will learn about what's happening in Moscow and will be able to join, because for the elderly, for some people who don't have their families or who don't have their loved ones near them, it is a chance to socialize, to actually feel cared about, because in these centers, there's truly a lot you can do. And there are a lot of activities on a daily basis organized for the people, different master classes, different webinars, and different activities. Just want to share this one with you as well. This is a culinary master class, and they organize these classes. Some restaurants and cafes organize them, and they invite professional chefs to cook something, to practice cooking some interesting dishes there. And also, anyone can organize a similar masterclass. For example, each of us, if you guys were in Moscow and wanted to organize a masterclass, a cooking masterclass or something like this, you would be welcome to do that. And also the people who go to these social centers, who are part of this community, they can invite their friends and they can initiate something. For example, I want to learn how to paint or how to draw or how to, just whatever skill that you want to learn, you can put on the information board there, and there will be people giving you advice on how to go about learning your new skills or what you want to learn, or you can actually invite people to create their own sort of learning space and launch master classes and courses in these 6 recreational zones. So it's amazing. Not just the professionals could be invited to teach and to give master classes, but anyone whoever belongs to this community could initiate something and learn from each other. So it's a very interesting way to connect people in these uncertain times when all of us are so worried about our loved ones, about ourselves. And this is a chance to meet new people. Although this time it's all done in the online format because our social activities are somewhat limited at the moment. We're not going to be in lockdown, but social activities are limited. So we cannot organize and do as much offline as before in the summer, for example. So this for me was a very interesting example of what is being done in Russia, because to be honest, when I was reading the book last year, I was wondering if something like you guys did could be done in Russia, and it would be so interesting because it's a huge country with different regions, different ethnicities living in the country. It would be so interesting from the cultural standpoint, from the professional standpoint, to organize people from so many different disciplines and to see how they work together, what their collaboration could bring in the end. And when I came across this project, the Social Center Urban Club, I was really impressed. I thought, wow, this is it. Maybe it's not as big as what you did, but it's definitely a step in that direction. It's something that brings so many different groups together, and I'm keeping my fingers crossed that it will spread further, that it will go to other big cities of the country and smaller towns as well, where the older people can actually come to light, as we say. They won't be hiding in their apartments by themselves, but they will be meeting other people, sharing their stories, what they know, what they can teach others. So it's really, really amazing. This environment, this kind of space that was created for learning, for sharing, and for caring about each other in these uncertain times. So this is basically it. This is what I wanted to bring to your attention, something that I felt very, very excited about, and I thought this is a great initiative. Maybe you have something like this in your cities, in your countries, or if not, maybe it's something to look at and maybe import, or something that you can talk about.
Great.
So this will be it.
So sorry, was there anything else, Marina? I sort of cut you off. No, is it?
No, go ahead. Yeah, that's it.
No, I was just reflecting last year at this time, Marina invited me to do a virtual lecture in Moscow. And at that time we weren't doing all these Zoom lectures, and it was interesting to think that that was going to be the new normal coming into this year. But yeah, this has been a really fascinating discussion, and I think we've gone well over the time, but I just want to thank everybody for sharing their insights, because it shows us all in this forum from all over the world that some of the key takeaways, we all had to collaborate and we all had to come together as a community in many different ways that we didn't anticipate. And not just in our local community, but globally, to reiterate behaviors that none of us had ever anticipated that we'd have to do, staying in our home, staying away from each other, protecting ourselves with masks. So I just want to ask all the speakers one question, and that is, if you could say one word, thank you to Marina for your word chart, which made me think one word that you would use to describe this year, or to, you know, define your feelings about this year. And if you could sum it up in one word, what do you think it would be? So I'll start with you, Tamsin.
Really terribly, because this reflects probably the end of a long week. I was going to say the word that reflects the year feels like exhausting. But I thought, what a negative thing to say. But I feel that for many of us, it actually has been exhausting. It's the interesting thing of working remotely. We require so much effort to achieve the same thing. So, but I don't want to be negative. So also hopeful.
Thanks, Tamsin. How about you, Carlos?
I think that for me, the word is grateful, because we've been through so much mentally, physically, and economically. It's just been such a big moment in history. But the fact that we're here with friends, the fact that we can communicate with each other, the fact that in my case, fortunately, my family is all healthy, I'm just very grateful.
And Danny, what would your one word be?
Astonishing on so many levels. And if I could give you a second word, it would be intense.
Yeah, definitely. And Marina, what would you pick as your word of choice for this year?
Well, certainly transformational in many ways. And as Tamsin said, exhausting. Both. So there's a positive aspect, and you know, it's been a tough year for all of us, really, but yet we learned a lot. I think a lot of learning opportunities have been thrown our way, and I think we'll be reflecting on this year for a long time. I'm kind of looking forward to the end of it, really. I just can't wait until 2021, and I think all of us are too. But we'll see. Who knows what 2021 will bring. But for now, though, let's be grateful for what this year has done to us in every way, because it's all part of the learning experience.
Yeah, and I would probably choose thankful along those lines. And it's coming up to one of my favorite holidays in the United States, where I'm originally from, and that is Thanksgiving. And normally at this time of year, I'd be preparing to go to the United States to visit my family, but that's not possible. But hopefully we'll gather our friends around in Brisbane to be able to have a Thanksgiving dinner of some sort. But yeah, I'm just very thankful that we've had amazing people around us. And me personally in the School of Design, I've had amazing colleagues that have pulled together to do things that I don't think we ever thought would have been possible at the beginning of the year, or even in our wildest dreams. But also just our colleagues here today that always keep driving me to do better and to do research when I'm totally exhausted with all the teaching work and the administration that I have to do. And you guys always come with really surprising and interesting ideas that make me want to go further. So thank you so much. And also to my colleagues from years past that I see here today from Canberra. You know, we've reconnected in different ways during this time, which has been really great. And I hope to connect with some of you that have joined in today. I'm sorry, we've kind of run out of questions, and I'm going to have to do a book. We've run out of time for questions, and we're going to have to quickly launch our book. But what I want to say is, if you have questions, what I will do is send out like a general email, and you can then ask us questions if you had any on our presentations to all of those that registered. But I'll just quickly go and I'll share my screen and do a quick pitch for this book that we've been alluding to and talking about in advertising. Let me just pull up our my screen. Let's see. I'll just share with you, actually. This is some of the images from the book. Now, this is some of the pictures from our book, the color part of the book. But it's a book that came about from many, many years of taking students abroad. This project started with an idea, and it started with probably talking to Danny during an e-card exercise and saying, hey, Danny, I do this thing, I do a study tour with this colleague of mine, Carlos, and that time our study tour is mainly focused around graphic and industrial design. And their outcome was creating product design solutions. It was very fun, but we decided to switch up the project. Then Danny ended up moving off to Melbourne, and I didn't realize, and I ended up sending him an email saying, where are you, Danny? Let's keep this conversation. And Danny said, actually, I'm in Melbourne now. So that opens up even more opportunities to collaborate. And this was the first time that we had ever done anything sort of not just cross-culturally, but cross-disciplinary with nurses. And also in Singapore, the nursing and design students never normally met together to work on things. So it was a really interesting way not to only to bring different cultures of people together, but also different disciplines that would never normally work together in a university. And it started off where we, the students just sort of observed centers. And in the second year, we actually got them to co-design with residents and patients. It became much, much bigger. And we included students from Hong Kong and Taiwan. And then we also ran concurrently, there's in the book also projects that ran in China that we ran in the University of Canberra, but also one of the other editors is here, Vivian, who ran some projects in Beijing. So this book kind of brings together a lot of these projects that we worked on, and also the ideas about best practice in cross-cultural groups, how you run these types of workshops, some of the challenges, and also the perspectives from the students and what they found engaging or difficult. So it's a real sort of celebration of what you can achieve and what you can get, what you can push students to do in 2 weeks, which is pretty amazing. So I might turn it over to Danny from his perspective from health, but from the students in design, a lot of them thought that this was going to be, you know, maybe a holiday. We pushed them and they learned so much. And I think one of the takeaways that I always had was we'd bring students that had never left Australia, and they had to do this challenging task of not only coming to a country they never thought they'd go to, and learning and exploring that country, but then working together with students from a different country and culture and becoming friends with them and learning about them, and then challenging themselves to learn about a population of people that they probably never really thought about either, which is the, you know, older population and their issues, and starting to step into the shoes of a different demographic group and having empathy for that group, and then going, you know what, I thought I was going to design surfboard graphics, but maybe I'll design for care homes because I also see this issue in my own country. So it was a really great way to open up the minds, not only culturally, but just transdisciplinary ideas of how students could work together. And I think a lot of these students between countries and between disciplines still collaborate, still catch up. And that was one of the best things about this project. But I'll quickly turn to you, Danny, and maybe Carlos for a couple of words about the book before we sign off, because we're running out of time.
Yeah, look, I just would say that, you know, what you said has been true for the nursing students too. That first trip was pretty amazing, and one of the more memorable moments was when I was in a taxi with one of the nursing students, and I think we had some of the design students in there, and she was really letting rip on a bad experience she was having with one of the members of her team. It was pretty funny, and the taxi driver was laughing all along because the expletives were coming thick and fast. Anyway, so there were many memorable experiences, and I think it was mind-opening for everybody. The design students got to work with people who are actually doing the work in healthcare and aged care, and then the nursing students got to think differently, because we really do in healthcare give our students blinkers, you know, like horses. And this was really appealing a way of that, so that they really could instead of just trying to hone down on a solution all the time, to actually think about something a bit more broad and think about alternatives, and then to be able to work with people with all those wonderful technical skills as well. So look, I'm really sorry that we couldn't continue. We still had some funds left to go this year, and gee, I mourn that, because it's always a wonderful experience seeing students work together in this really different way.
Carlos, did you have any thoughts that you want to share about the book?
Oh, absolutely. I think it's, well, on one hand, it's such a great memory, and I think we had so much fun, but especially we created such an amazing learning experience, both for all of us as tutors and for the students. I'm passionate about this idea of cross-culturality, having myself lived in different countries and learning from all those different cultures. I think this is very, very important, a very important skill for today for designers, and what we call the cross-cultural awareness, because we're designing globally. So this is definitely very important. And it also, for me, was this idea of the synergy between teaching and research, because many times we see that our research is competing with our teaching, or usually vice versa. We're teaching so much that we're not being able to do our research. But how great it is when we manage to achieve that synergy, and we manage to embed our research into our teaching and feed our research from the collaboration with our students. And in all this panorama, it's so wonderful that we also managed to weave some very, very nice personal experiences from ourselves and from the students, and especially as Lisa was saying, for some of the students that it was the first time going out of the country, or for some of the students that it was definitely a life-changing experience, or some of the best experiences in their whole university life. That is just such a great feeling, and I'm so happy with it.
I think we're sometimes lost for words about the experience, aren't we, really? Because it is, and will continue to be, I think, when we do this sort of work, you know, it leaves us often speechless, and particularly with the outcomes. I mean, some of the ideas that these cross-disciplinary teams, cross-cultural teams come up with are just absolutely surprising. And yeah, it was interesting, Tamsin, when you one or two of your slides, I thought, oh, I'm pretty sure the students came up with something similar to that. So yeah.
Yeah, and I'd also like to acknowledge we've got Greg Muse here, who did a lot of amazing editing work to get this book over the line. So he helped us really pull this together when I was pretty exhausted starting my role as head of school and didn't have any time to do things like that. I had Greg as our sort of savior, bringing us all together to get over the finish line with this. And yeah, it was a collaborative effort of so many people that aren't even here, because we co-authored a lot of the chapters with our colleagues overseas that aren't able to join us. And also the book is published out of the UK, and our colleagues in the UK that helped us. And I've sent many, many emails back and forth to the wonderful staff at Intellect Books, but it was 4 o'clock in the morning, and I didn't expect them to get up for this, but they wish they could be here, but sent their best regards. And I put up a link to the book if you guys want to check it out. It's available as an ebook. I haven't even none of us have received the hard copies yet because the post is so slow at the moment, but there's a physical book somewhere in the post for us. But yeah, it was a fabulous initiative to have, and also I hope that you can all have a chance to have a look at it, or at least just read the overview. And if you're interested to hear more from our fabulous guests, I will, as I said, send out an email that you can communicate with them. I also want to thank particularly the Design Lab for hosting this, and Yvonne Miller, our fabulous director of the Design Lab, Without her, a lot of these initiatives wouldn't be possible. She brings together people all the time to talk about different issues. And like myself, Yvonne's passion is for design for health. And that's one of the key themes of our design lab at QUT. So we always welcome new relationships and new possibilities. And I'm gonna, you know, pick the brains of Tamsin, Carlos, Marina, and Danny for more ideas to collaborate into the future. So we've gone a bit over time. I just want to say thank you all for listening. I'm sorry we weren't able to have a much more engaging chat because our time went over a bit. But it's been wonderful just to hear from different parts of the world. I felt like I went on a little mini holiday to different countries today. So we've been around the world in 2 hours, which would be difficult traveling, impossible really. So thank you very much for joining us for this exciting chat. And I wish you all a good day or a good night or whatever time it is in your part of the world.